Welcome to Doctors on Call. I'm Jenna Miller. If you live with pain, you are not alone. Pain affects more Americans than diabetes, heart disease, and cancer combined. Pain attacks the human body at every vulnerable target: muscles, bones, and joints. Each person and their pain are unique. More than 20% of U.S. adults have chronic pain, and pain sufferers statistics show that women are more likely to experience pain than men. The best way to manage your case could be very different from what works for someone else. Pain management is our topic tonight on Doctors on Call with our guest, Dr. Belle Razafindrabe.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Russell Regional Hospital, experts, neighbors, friends.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.
Dr. Belle Razafindrabe earned his medical degree from Université de Madagascar and completed his residency and training in physical medicine and rehabilitation at the Loma Linda University Medical Center in California after spending a year of internal medicine internship at the same institution. Dr. Belle is certified in physical medicine and rehabilitation by the American Board of Physical Medicine and Rehabilitation. He moved to Great Bend in 2005 and is president of Pain, Spine, and Rehab, PA. Doctors on Call brings you information which may be useful to you when you see your own physician. Thank you so much, Dr. Belle, for coming back and visiting us. We got plenty to talk about, so let's get going with it.
Thank you, Jenna, for inviting me this evening. I hope our talk will help the public get the latest information on pain management.
Absolutely, you're our go-to guy. Let's talk about new procedures that you have going on at your clinic.
The new procedure that we have is really focused on minimally invasive treatment of pain. It's not really a substitute of invasive treatment of back or traditional spine treatment. It's a complementary to it. And those are including some tools that will help patients recover quicker, a quick recovery, but it requires very specific diagnosis and location of the problems. So I can tell you a few of those that especially addressing the lumbar spine. We talked about minimally invasive spine. You know, the problem of the spine are mainly either disc or stenosis, bone spur, or ligament hypertrophy, and a combination of that. When those specific problem is diagnosed and found out, then we have a specific treatment that deal with it. We have use of the disc is like this. When it's getting thin, the ligament get tight and become there's not much room for those nerves to come out of those nerves. This spacer is a very handy tools that will help decompress the nerve and at the same time fuse that segment. So that is been done in our clinic for 2 years now and have a very successful rate for people who really need it. It's been done in about 30 minutes to 45 minutes. The same type of procedure can be done in the lowest part of the spine using different type of decompression and spatial instrumentation to help decompress those nerve roots at the same time. We talked about endoscopy. Endoscopy in the spine is very new, and we didn't learn it in residency or fellowship, but because of the new instrument and those research has been done, I believe that in the future the new student and resident and fellow will start to use them and will be more popular. But for now, we have this endoscopy. Endoscopy is a way of treating pain that we never experienced before, and I can show you a few pictures of that. This is some way of how endoscopy will treat patient. In any holes in the spine can be approached, and this endoscopy about 6 millimeters of diameter can get into the tightest foramina or in the lamina, and you can see the approach, multiple area, get into the disc, get into the tight spot of the spine, and can ablate. And not only that, but it has a way of coagulating the area, so it will remove the disc that is bulging, herniated, and at the same time as a tool that will seal that area to be really healed right away, almost. So that is a very good option. Why is it important? It is important because there are people who are not really wanting to have big traditional surgery at all. They would say no, stop. And this can be an alternative for them because you can do it with a conscious sedation, and then it can be done within a very short time. Even those people who have a cardiac output that is 11%, those can have some this surgery. We have someone who will be 400 pounds that not really will have a very difficult big traditional surgery, but with endoscopy you can get the cannula, the small, actually the bigger body will be helpful to actually hold that cannula into space, and the spine will look the same, and it's very giving opportunity for those people who never able to be a candidate for spine surgery, get that. So if you have a spine this way, the endoscopy is a very small opening, get into this area, and then that area become a big field because we look at the screen and like playing a video game. So this small area of 6 millimeters will be seen in a nice video 4K that we can see all the details there. The artery, the nerve, the ligament, the dura of the spine, and then there's a fluid that comes in and goes to clean it up at the same time. And we can really see, hey, that nerve is decompressed, that disc is healed, this stenosis is done. So technology has been helpful to make sure that everyone get treatment and so on. People don't want to spend too much time of recovery. The faster the recovery is, the better. The less tissue injury is better for some people, and this is a good alternative to traditional surgery for those who are candidate for it.
Excellent. Okay. Well, we've got somebody who's wanting to ask you a question on the line. This is Rosie from Victoria. Go ahead and ask Dr. Pell your question, Rosie.
Hi, Dr. Bell. This is Rosie from Victoria. I wanted to know if you do the PRP. It's something with the spinning of the blood. So I was just curious to know if you do that. Thanks.
Thank you, Rosie, from Victoria. Yes, in great band. About 4 years ago or so, I started PRP. For those who don't know how it's done, it's platelet-rich plasma. We've talked about stem cell, and this platelet-rich plasma has the equivalent of that stem cell that get into a tissue and help regeneration of the tissue. We do provide PRP in our clinic for those people who are really selected to need that. Very useful for someone who have tendinopathy, people who have tennis elbow, pain in the elbow, that tendon that is really painful. Surgery is done for that. Injection has been done for that, but in my experience, PRP works the best for those. We have some people who need it for chronic pain, and it works well. The only drawbacks is that very few insurance cover for it, so it's most likely like a self-pay one. But that's what I can answer to you about PRP.
Okay, let's talk about the different types of pain that somebody might be experiencing and how you can help them.
The pain I can tell can categorize into spine-related pain and non-spine-related pain. Non-spine-related pain is pain of arthritis, fibromyalgia, myofascial pain, and all kinds of pain. Pain, as you mentioned, that 21% of Americans have chronic pain, and 7% of Americans have high-impact chronic pain. High-impact chronic pain is a pain that really interferes with daily activities, work, and may cause depression and all of that. So within those, there is a non-spine-related pain that is a vast majority, and then also spine-related pain. And spine-related pain are divided in spine-related pain and non-spinal related pain. Those are also, people with back pain not necessarily have spine-related pain. Let's see, in a lady, endometriosis can cause back pain. For older people, we need to be aware that aortic aneurysm can cause back pain. And those sacroiliac joint pain can cause non-spinal related pain. And so low back pain. So there are a variety of non-spinal related pain. Urinary tract infection or urinary tract problems, stone on the bladder, stone in the kidney can create a pain that looks like sciatica, but it's not sciatica. So when you see the patient, you need to really find out, is this related to the back or is it something else? The spine-related pain is very specific and very treatable as well. The spine either from the disc, from nerve, pinched nerve, sciatica, is it stenosis that really causing patient to not able to walk for long? A variety of pathology and diseases in a different form. So those are our form of, if we can, in general, type of pain.
Sure. Okay, we're going to go back to the phone lines. We've got Rosie back on the line for Victoria. She must have a second part to her question. Go ahead, Rosie, with your question for Dr. Bell.
Yeah, I wanted to know, does the insurance pay for all of this, or do people have to pay something up front? That's all I wanted to know. Thanks. Bye-bye.
Is this about the PRP? The PRP depends on insurance, but most of them, except work compensation, has to be, self-pay. So far, and it is worth it for those who really have the pain. We remove the blood from patient, centrifuge it, and then inject into the area that needed the most.
Okay. Mm-hmm. Let's talk about bulge discs, what they are, and how you can help a patient who might be suffering from one.
Mm-hmm. Bulge disc is a disc that is bulging most of the time from the posterior of the spine. That bulging disc can be central, which is in the midline of the spine, pushing the nerve backward, and that can cause cord injury, the spinal cord injury, and created type of cord neurogenic claudication, means that the patient will walk about 100 feet or so and then have to sit down because that cord is pinched. And that is herniation of the disc in the middle of the spine. That herniation usually happens to the left side, and it can be away from the midline, and that's very common. And when it's away from the midline, it can pinches the nerves right there at the exit. And those are very common form of sciatica. And those discs can be bulging, it could be extruded, it could be migrated downward or upward, depends on it. So the thing that is important is to remove those discs and cauterize it. And I mentioned here about endoscopy. Endoscopy is a good way to do it because it will get into the disc, find the disc, and cut it, remove it, and seal the disc that is left in place. As I mentioned, myself had a personal pain, back pain, for about 20 years. When I was in residency, I had pain in 2000. And so I've been having this pain on and off. We did not want to have surgery, but from time it's hurting. And so I had some injections, steroid injection, which helped me. And one time I was planning to go to Europe. I had so much pain, and so I had injection that helped me finish that trip. But when I come back, I said, I really need to get this done. Because of I know the problems, I know where it's located, I was looking a way for treating it in a very minimally invasive way. I couldn't find anyone that provider that can do it in my friends and stuff in Kansas. So unfortunately, I have to fly outside of the state to get the surgery done. And I'm glad now that I don't have that type of pain anymore. But this is what I mentioned to you. When we bring this technology to in a rural place, Kansas, then it will be very useful that people can be treated locally. And you don't have to go any place in the metropolitan or out of state to get that treatment done. So hopefully that with the skills and the equipment, and we will open to local people, we will help people with those disc problems well, and not only disc pain, but those people who have called stenosis, because not only the disc, when the disc is really thin, the bone have spur and ligament also hypertrophy or bulging. So you don't need to only deal with the disc, but we might need to drill the opening, the bone, and the endoscopy is able to get into it and drill it very efficiently and create room for those nerves to be surviving again.
Sure. Now, when a patient comes into your office, how do you assess their pain? What can they expect coming in?
When patients come to our clinic, most of the patients we require that they need to have referral from primary care or whoever. And most of those patients have been exhausting something conservative treatment, therapy, chiropractic, acupuncture, exercises, pain medications, and they come to us or have MRI done and all of that. Some people have 20 years of pain. When they come to us, most likely we will evaluate, assess, and see what type of pain do you have. And most patients have multiple pain, neck, back, thoracic, and so on, but we select which one can be treated first that allow this patient to be more efficient and productive. So treating the pain is not only to reduce the amount of pain, but how to make this patient more functional. How to make this patient, how to help this patient being productive and able to keep their work and able to be functional within community and not to be a burden for their spouse or their family, you know, all of that. Because we notice that most of the chronic pain, the people who are divorced or separated, twice the amount of pain than people who are happily married. And in the rural area have more pain than in metropolitan area. So we are in a place where we might have people who need our service. So that's what we do. Look at that and see where we can help this patient the most. I usually start with lumbar pain that causing pain to the lower limb, the legs and sciatica, because if you have back pain, to have leg weaknesses, this patient cannot walk, cannot function, and then I will save the neck pain later on. So that's how we do it, and then we schedule it as soon as possible, sometime even the next day.
Okay. Is there any benefit from, it sounds like sometimes people come in with you as their kind of last ditch effort. Is there a benefit of coming to you first rather than waiting?
There is always a benefit. As I mentioned, I waited for 20 years to get my treatment done. And there are not a few patients who have experienced the same as I did. I think the sooner the better, you know, especially if the disc is contained, not herniated, that the treatment of that is much easier and faster. And if the disc is herniated there for a long time, it can be calcified, and even removal of that disc can be more difficult. So that's just an example of being mentioned about red flag for back pain. There are people that red flag I mentioned if there is some infection underlying, osteomyelitis and stuff, fever, swelling, redness. Those need to come sooner. If there is any cardiac, means patient may have loss of bowel and bladder, and pain related to that means that some things pushing on the nerve and cause that. If there is any so much pain at night, new and so on, it could be a cancer, metastasis to the bone, or cancer of the bone need to be assessed. So those are things that urgent. And there are some yellow flag. I mentioned yellow flag is patients who have pain and have some psychological component to it. Things like catastrophization, dramatization, or fear of avoidance, that will prolong the recovery and the treatment of that patient. So I would address that this patient need to be addressed with psychologists to really cut those problems, because that can interfere with the recovery of the real treatment as well.
Okay, all right. We have just a little bit of time left for the show, and we've got a caller waiting to ask a question. This is Cynthia on the line from Hayes. Hi, Cynthia. Thank you for calling Doctors on Call. What's your question for Dr. Bell?
Yes, I am having some pain in the buttocks area, and I have some bulge discs. I've done a lot of physical therapy and chiropractic. I've done dry needling, massage work, been to a kinesiologist. I was just wondering if you could do something to help with that.
Thank you for your question. You are not alone. We have most of my patients have the similar type of pain. I cannot. I will be happy to see and evaluate you, but those are the most common problem we have. And once we found out the source of your pain, probably there will be very likely we'll able to give you some treatment option for those.
Okay. Is there sometimes what you were saying, even the psychology, but is there stuff that we are eating or putting in our bodies that can be causing pain?
Oh, that's a very good question. That is part of conservative management of pain. Diet, lifestyle, exercise, those are important, because there are something we eat that very inflammatory, causing more inflammation. Let's see, fat food, we can see refined sugar, refined those things. Those are pro-inflammatory, so create more pain. Tobacco. So some lifestyle change is very important. Being fit, usually people have more fitness, has a high tolerance of pain. So what we do can cause pain. If I have patients who have some inflammatory issue of pain, I can say, hey, go back to plant-based diet, stop using soft drink, use water, stop tobacco. That alone can promote very good health and lessen the pain, and also enable us to treat the pain more effectively and efficiently.
Okay. Just a little bit of time left. You want to advise our audience the best way to get out of pain and stay out of pain?
Oh, the best way to get out of pain is to know your body and know your pace. There are some activity that we can repetitively done that has been hurting us. We need to find a way to stop it, or also find a pain. Someone who work in an assembly line, that really can be hurting for them. If it's too much for you, then you find some way to make it less. And posturing, there are some bad posturing that we need to forget about it, need to change. So pain is starting from ourselves. We need to know our pace, what we can tolerate, and what we can improve ourselves. That will help a lot in the management of people with chronic pain.
Okay, excellent. Well, thank you so much for being our
You're
guest.
welcome.
It
was a pleasure to be here.
Yes, we hope to see you the next time. So
Sure.
Thank you so much for being our guest on Doctors on Call. That's Dr. Bell Razafindrabe from Great Bend. On our next Doctors on Call, we'll be discussing general health questions with Dr. Tyrell Summers of Russell. You can email questions to us for our next program. That address is doctors@shptv.org. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Russell Regional Hospital. Experts, neighbors, friends.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.